This is LiveWell Talk on Stress in the Holidays. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. The holiday season is upon us, and it can be a happy time full of family, friends, and celebration. However, various situations and circumstances may make it more difficult, full of stress, anxiety, and or depression. Returning the podcast today is Theresa Graham-Mineart, Senior Director of Outpatient Services at Abbe Mental Health Center, to discuss types of holiday-related stress and how to manage it. Theresa, welcome back.
Thank you, Doctor.
I think that I was thinking about this podcast, and the thing there's a lot of stress with the holidays, but a majority of it's self-inflicted.
Absolutely.
Meaning, and I think of and I'm guilty of this too, in some ways, of setting expectations that are just not realistic.
Absolutely. The holidays tend to be a series of excess, financial, all the gifts, all the parties, the meals, all the people. And sometimes we sacrifice quality of interactions for quantity, and it's the expectation.
Yeah.
I have to do this.
Yeah.
We have to do these things. When in fact, what we really have to do is be connected.
Right.
But it doesn't feel that way at the time.
No, it doesn't.
Yeah.
And I don't, I'm anxious to hear some of your advice about that. But I was just thinking, I think we put so much pressure on ourselves. And are the Christmas cards done? And we got to get them sent out. And so-and-so sent us a card. They're not on our list, And
Yes.
There's a lot to it. But what do you and your team see the most with the holidays?
We see a variety of concerns. We see some financial concerns. The holidays can be expensive for a variety of reasons. We see concerns about expectations in terms of my family really wants to do this, but I'm not sure about that. I've got to balance seeing my family too. But oftentimes we also see remembrance. And that can be a positive thing, thinking about people who aren't with us anymore and, reminiscing and whatnot, but it can also hurt. And sometimes people feel like they're supposed to be happy from Thanksgiving to New Year's.
Right.
And it just isn't like that. There's a variety of emotions that this time of year can produce, and ignoring them or wishing them away isn't usually helpful.
Well, I don't. It's in some way it's been a blessing. During my marriage, my parents had passed away before I got married, my mom shortly after. But so there's only one family to deal with, right?
Yeah.
But sometimes if you have two families,
Yes.
or you meet some people that are like, well, yeah, I have to go Christmas here at noon and then Christmas there at 6 p.m. and that can be quite stressful, I
Absolutely.
imagine.
When our kids were young, my husband and I used to call it the Christmas tour. We go to one set of grandparents on one day. We do us at home. We go to another set of grandparents. There's a third set of grandparents. We've got great-grandparents 4 hours away. And again, that's a situation where we're sacrificing quality for quantity. It doesn't come from a bad place. It comes from wanting connection and respecting traditions, but it comes at the expense of our mental health. And if we can, reassess the have-tos for what really we want to do, not in a selfish way, but in a way of promoting really quality interactions. Overall, that's better for our anxiety, and we end up having a better time.
Yeah. I don't know where I read this recently that some leader in the business world would start every meeting with, "We are all going to die, and what we're about to talk about really doesn't matter."
Yes. Yeah.
Now let's go forward. And I thought, wow, that's actually kind of good advice.
Yeah. Well, and there can be a lot of competition about where you're at on Christmas Day. The day is not nearly as important as who we're with. And so if we're with one family on Christmas Day, is it such a big deal to maybe schedule something the following weekend? Is it great to have breakfast, lunch, and dinner at 3 different places with all the gifts and all the people? Not only from a mental health perspective, that's very tiring, but honestly from a physical health perspective as well. Thinking about being healthy during the holiday season, we really don't do ourselves any favors when we set up expectations that we can't possibly achieve, and then we feel like we've done something wrong. That we aren't. Everybody else looks like a Hallmark card, but they don't. They're tired too.
Yeah.
Right?
Exactly.
Everybody's
exactly
going through it.
how
Yeah.
that's perfect. That is the perfect way. So eloquent. Everybody else looks like a Hallmark card because that really is, or the Hallmark channel and the movies on there. Yeah,
Yeah.
real life's not that.
No, it is not.
Real life is vice
Yeah.
with all the, the
Yeah.
imperfections, because
Mhm.
we're imperfect people. Uh, I think the depression, I don't, you'll know the answer to this,
Mhm.
but suicides, they increase in the holiday season, I believe.
And so there's some question as to whether or not that's really a result of the holiday system or holidays, or if it is related to daylight. So keeping in mind that depression and suicide correlate with the number of hours of sunlight that we have. Parts of the world that have more sunlight have less seasonal depression. Parts of the world that have more evening time, they have higher rates of depression. So it's hard to know how much of it's holiday and how much of it has to do with sunlight. Either way, taking care of ourselves, having reasonable expectation, moderation in all things,
Yeah,
is a great way to have a better winter and holiday season.
I just got back from Alaska.
Mhm.
My oldest played basketball up there, and sun would come up about 10 in the morning, 10:30, and then go set about 2:30.
Mhm.
And it felt odd,
Yes. Yes.
and I can imagine being up there, even farther north, it's less
Absolutely.
daylight.
Yeah.
And I think it does affect the suicide rate in the
It does.
state. I think,
It does.
yeah, does it?
That
Yeah,
is accurate. Yeah.
I've
And
heard
then if
that.
you go towards the equator, you see a different scenario in terms of seasonal depression and those kinds of things. Some people say, well, if you live there, you're acclimated to it, but the science doesn't bear that out. We really do see higher rates of seasonal depression in places where there is, and at times when we don't have as many daylight hours. Mhm.
Wow.
Yeah.
That totally makes sense. I mean,
Absolutely.
and some people are more sensitive than others. I'll say that,
Sure.
but I
Yeah.
think it's
Yeah.
something we need.
Mhm.
And as kind of with the COVID and the discussion of how vitamin D is important, and evidence is playing out that you certainly don't want to be vitamin D deficient.
Correct.
Taking extra vitamin D may not protect you from viruses or bacteria or
Mhm.
dementia, but definitely deficiency does impact functional capacity.
Mhm. I know our family doctor recommends vitamin D supplements to a variety of the people she sees because overall people do tend to be deficient in that area. Certainly, I'm not a doctor and not giving medical advice, but it is important whether you get that from sunlight or from vitamins or whatnot. It is an important part of overall health.
Yeah, it's kind of talking in the weeds here, but there was a Dr. Carney, and he was a retired physician, and he became my friend, but he was about Dr. Harris's age, and he practiced over in Tama, Toledo area in Grinnell. And I would see mutual patients over the years, that had him, and they'd say, "Oh, I just need a Carney cocktail and I'll feel fine." I was like, so I was over at his house watching an Iowa basketball game. I said, "Hey, Doc, what's a Carney cocktail?" He says, "Oh, I used to just give them steroid and B12, about February. And by the time that wore off, their vitamin D levels are back up and they were fine." I thought, that kind of makes sense. I don't know if I'm going to do it, but
No.
but he had
Absolutely.
noted that people were coming in,
Mhm.
and that was before he had seasonal affective disorder.
absolutely.
So do those UV lights work for that?
Yes.
They do.
Yep. Science does show that they do work. It's important to talk with a provider to make sure that you're ordering something reputable. If it's on the internet, Dr. Pepper isn't a doctor. Just because somebody recommends it doesn't mean you want to order it.
Right.
But yes, they are effective for people who have seasonal affective disorder. It's a great thing to talk about with your provider so that you can decide if it's right for you and you can make a good choice.
Yeah.
Yeah.
I had mentioned viruses and vitamin D, but the pandemic, COVID, whether or not the pandemic and it's endemic, it really doesn't matter. If you get it, you're sick. Certainly, it's not as virulent over time, which is expected for coronaviruses, but it's still here.
It is.
And how does that influence people's happiness during the holidays?
Absolutely. Well, I think we continue to see discussions about how many people I want to be exposed to, if I have an underlying health condition, if I have an infant or an elderly person in my home. And that can result sometimes in conflict around, usually we all get together and we haven't been able to do it for 2 years and now we finally can. And why aren't you cooperating? So I think that those discussions still bear fruit. I do believe that we're also very much in a recovery stage. Yes, COVID is less perhaps dangerous in some ways right now. We're seeing fewer deaths as a result, although we see an uptick in transmission, particularly in Lynn County right now. But we're all still healing from that event, going those couple years with very little human interaction, but the passage of time. And so I feel like people are really still connecting, getting used to being around people again. And I have definitely heard, and my peers have heard more concern about being around a lot of people. We've been through something that kind of changes your mindset. And so I do believe that's something some people have to address as they think about getting together with Aunt Jolene and her 12 cousins and, all the things and all the people. But certainly getting good sleep, taking care of ourselves, moderation, and then, masking, social distance, and hand washing still apply.
Yeah.
Yeah.
I can remember my wife's grandfather, Grandpa LaGrange. They had 15 kids, then grandkids, and, and you go over there and at holidays, and he would be sitting there just watching TV, and then you go to talk to him, and he turned his hearing aids on because he'd had them off the whole time he's sitting there. I was like, that's brilliant.
Yeah, it is.
No wonder he's always happy.
Yeah, there you go.
We probably could do a whole podcast on this, but when the pandemic started, it was very scary. It was very unknown. We were, as I've said before in other interviews and on podcasts, that we were building the plane as we're flying it, right? But there also was a sense of, I don't want to say giddiness, but relief that we didn't have to go to these same old meetings all the time and do all that. And I think we should reflect more upon if you're not enjoying what you're doing, then do something else.
Yes. Agreed.
I think Marcus Aurelius said, if you fear death less than you fear what you're doing, then stop doing it. And I think that kind of applies to the holidays. You're living somebody else's expectations.
Exactly. I think it's a really great time, and I think a lot of us have taken a minute to reassess what's important. Thinking about work-life balance, the kinds of relationships that we want to have, and the holidays play into that as well. If you dread going to great-grandpa's whomever because it's people are mean. People don't treat each other with respect. You don't feel safe there. I think people feel more empowered to say, I'm going to opt out. And again, that's really looking to gain quality experiences over quantity. Right?
I think that's okay, though.
It's not really, just okay, it's important.
Yeah, we need to start encouraging that.
Absolutely.
That you don't live your life for other people's expectations or this sense of what other people have, because they're living their expectations for someone else too.
That's right.
You might be doing them a favor.
Yeah,
so
absolutely.
So prior to asking whether or not how I could get scheduled for counseling if needed, another Christmas question is: Die Hard a Christmas movie?
Well, it's got Alan Rickman in it, and if he's in it, I'm okay with it being a Christmas movie. He's a great actor. Yeah.
I think it is a Christmas movie.
I think it is too.
Some people say no, but I
agree.
I think it is.
I agree.
I think it is. Hey, if a listener wanted to get some help at Abbe, how would they go about that?
Absolutely. So we have we serve an 8-county catchment area in eastern Iowa. Our main office in Cedar Rapids, 319-398-3562. An individual can call in and we can help get them connected with the services and the location that works best for them.
Well, I'd just like to send a message to the listeners of the podcast that you're not alone. There are people out there to help you. Theresa, thanks for coming again. Always enjoy talking to you. Once again, this was Theresa Graham-Mineart, Senior Director of Outpatient Services at Abbe Mental Health Center. If you'd like to talk to someone at the Abbe Mental Health Center, call 319-398-3562. For more information on all services offered by Abbe Health, visit unipoint.org/Abbe Health. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.